representatives of civil society organizations here present, journalists, reporters, media owners here present. Welcome to this third press briefing on the Marburg situation in Rwanda. I would like to start by inviting you, Honourable Minister, to deliver your remarks, as we always have done it in both languages, and then receive questions from media people. Thank you, Minister.
Thank you. Good morning, Dr. Chilombo. Thanks so much for joining again. So, colleagues, friends, media, civil society organizations. So, again, we're here for the third time, briefing you on the progress and the response to this Marburg outbreak. So you're seeing some progress, some good trends. The past 7 days, we've seen more recoveries than deaths, which is a good indication that the response and the treatment is actually making some good hope of the end. Secondly, we have recorded 3 days in the last 7 days. In those 3 days, we tested samples and we had 0 cases. So it's also unique for this week, but doesn't mean the testing and new cases have already ended. It means that at least the risks of transmissions is being contained. And also it means we need to follow up the context that we have in isolation to make sure that they don't start new transmissions. The other highlight of the week is that vaccinations have continued. We've reached more than 600 vaccinations so far. Of the 700 doses we received, at least more than 600 have been already utilized. But yesterday we received more doses. Last night, about 1,000, which means we are going to continue to protect the most at risk, particularly the healthcare workers at the front line. Those in treatment centers, they have been all vaccinated. And those in high-risk services, especially those who are exposed in ICU and the close contacts, a majority of them are also being vaccinated. So we're expanding a little bit beyond those most at risks. But as you detect one case, you also have close contacts. And this vaccine is actually mainly to protect those who are likely to get the virus after having in contact with a positive case, which means the earlier you protect them with this vaccine, the better for them, but also for the public, that no new transmissions are expected. At least you minimize the chances of the virus to continue spread and to improve the outcome on the patient level. So those are the 4 major highlights of this week. There are more we can talk about, but we've been putting in place mechanism to share every evening all we know about this virus. We have 61 people already tested positive, 29 are already under treatment. Of these 29, about 3 are in critical condition, but others are improving, recovering, which is also a good thing, that our treatment teams are working to make sure they don't move into critical care. And those in critical conditions are receiving the best care we have. We've got teams both in country and those that came to support, and we appreciate also the support through the WHO to bring in some expertise as well. So unfortunately, we've lost 14 lives due to this outbreak. Majority of them are healthcare workers, which also means the other consequences and implications to everyone who was consulting them before. They were supporting these hospitals, the families. It's a big loss, as you can imagine. And we are also making sure the gaps left in those departments where they are working, because they were highly specialized, are also supported through our partnership. So, as I said before, recoveries are now more than death, which means also the outcome of the efforts put in place. We've already had 18 people who recovered, including 2 that recovered yesterday, and we expect more to be recovering moving forward as they test negative twice. Basically, what we mean recovery is 2 negative tests. First negative, then you wait 72 hours, you do another test. If the 2 tests are negative and the patient clinically had improved, don't need to stay in treatment center. You move into post-treatment recovery follow-up, which also will be something we continue to monitor for some time. So testing is key, but contact tracing is also important. We also understand the importance of making sure this virus is contained quickly for us, but also for our neighbors from near or from far. So we've put in place several measures at different points of entries, including Kigali International Airport, to screen every departing passengers, checking on symptoms and ensuring that contacts who are supposed to be in isolation do not travel or move out of isolation. So we have mechanism to assess that, but every passenger going to airport has to fill a form electronically, and the form is connected to our contact tracing system that if you're a contact, you cannot be able to proceed in travel because you are still under follow-up. So we are doing this for Kigali International Airport, but also for other borderlands, and also within the country, make sure contacts do not, if they are given instructions to be self-isolated or isolated in specific areas depending on the levels of contacts. We have red, orange, and yellow and green. So depending on which category belongs to, there are different guidelines that are provided. So this is to make sure we contain the virus, but also we don't see a case moving out of this cluster that we are containing within Rwanda or outside Rwanda. That's all important to note. So we've had a great partnership that is both within Rwanda and also from outside, which means also the importance given to this response. We continue to work with our partners and also different stakeholders to make sure we end this outbreak quickly and then go back into our normal routine. So briefly, this is what we can share with you today. We're very happy to take some questions or comments, and my colleague from World Health Organization also may add or make a comment maybe during the question and answers. So I know Julia is going to ask me to speak in Kinyarwanda, but I will be very brief so that we give more time for question and answers. So nashaka kubabwira ko muri iki cyumweru gishize twakomeje guhangana n'iki cyorezo cya Marburg. Hari ibipimo byiza biri kutwereka ko imbaraga ziri gushyirwamo ziri gutanga umusaruro. Icya mbere ni uko muri iki cyumweru nibwo twabonye iminsi 3 aho twapimye abantu tugasanga n'uwo twapimye uwo munsi nta wagaragayeho ubwo burwayi bwa virusi. Ni ikintu navuga ngo kiza ariko kitatuma twirara, kuko kuba twapimye uwo munsi ntitugireho tubona ntibivuga ko ejo ariko bizagenda ko iyi virusi nyine ifata iminsi kugira ngo ayanduye abe yagaragaza ibimenyetso ndetse abayanapimwe akaba positive. Twizere ko bizakomeza gutya, ariko biraturuka ku mbaraga ziri gushyirwamo haba kuri twe turi mu kazi ko guhangana n'iki cyorezo, haba n'abatwumva bose ku buryo wumvise bya bimenyetso wese atwitabaza, kuko nibwo tumenye yuko hari n'uburwayi. Hashobora kuba rero hari abantu bakiri kubyitiranya na izindi ndwara zisanzwe, malariya n'ibindi. Hari aho twagiye tubona umuntu akeka ko ari ya malariya igarutse, hanyuma tukaza gupima tugasanga ari Marburg, wakurikirana ugasanga yari no muri afite aho ahuriye na bya bitaro handi twabonye uburwayi. Rero tuributsa abantu bose yuko bakomeza nabo kugiramo uruhare rukomeye, kuko iyo abyihereranye abatangiye ubundi bwandu ku rundi ruhande bunagorana cyane kuba twabimenye. Ikindi twabonye muri iki cyumweru ni uko abakize bakomeje kwiyongera, bakaba bamaze kuba 18, abitabye Imana 14. Nabyo biratanga icyizere yuko ubuvuzi buri gutanga umusaruro, ariko no kuba turi kubona abantu kare barwaye bagahita bavurwa, nabyo biragaragaza ko gupima kare ari ingenzi. Kandi upima ari uko wabimenye, ubimenya ari uko ufite nyine ibimenyetso n'uburwayi cyangwa wahuye n'abarwaye abitangaje ku gihe. Nacyo ni ikintu dukwiye kwibutsa. Icya gatatu cyagaragaye muri iki cyumweru ni ibijyanye no gukingira. Gukingira byarakomeje kuri doze 700 twabonye, 600 zirenga zamaze gutangwa kugeza ku munsi w'ejo. Uyu munsi turakomeza gukingira. Dukingira rero abantu bahuye cyane bahuye n'iyi virusi cyangwa bahuye n'urwaye, kugira ngo tubarinde ko yabatera ubwo burwayi nyine, kuko iyo yamaze kwinjira mu mubiri ibyayo n'imiti iri kugenda itangwa ntabwo biba byizewe cyane, ariko icyiza no kuyikingira ngo itaninjira. Rero urukingo rwagiye rutangwa cyane kuri abo, ku baganga bari kuvura cyane, ntabwo ari abaganga bose, nta nubwo ari urukingo rwagenewe guha abaturage bose cyangwa abaganga bose. Ni urukingo uha umuntu wahuye n'iyo virusi, byo bita mu rurimi rw'icyongereza ring vaccination, cyangwa se ukaruha umuntu ushobora gufite aho ahurira n'iyo virusi mu buryo bwihuse cyangwa se uri kuri risk. So abaganga barabyitabiriye cyane abari muri ako kazi, ndetse ubwo doze 700 twari dufite zari zisa nk'izidushiranye, ariko twaraye tubonye izindi doze 1000, uburyo biza gutuma abari bazikeneye bose babyifuza rubasha kubageraho. Turakomeza rero gutanga urwo rukingo kugira ngo duhagarike ikwirakwira ry'iki cyorezo. Gusoza no gushimira abo turi gufatanya bose, abafatanyabikorwa benshi cyane bari bahurizwe hamwe na OMS, umuryango ushinzwe ubuzima ku isi, ishami ry'umuryango w'abibumbye. Umuyobozi waryo mu Rwanda ari hano, bagiye bakusanya bafasha kugira ngo abadufasha babashe kuza mu nzira nyine y'ibyo twese tugamije kugeraho, ndetse hari n'abandi bagenda baza mu gahoro. Mu gusoza ni ukwibutsa ko urugamba tuzarutsinda, ariko ari uko buri wese akizemo uruhare. Hari ababishyizemo ingufu, ariko hari n'abandi bumva umuntu umwe babiri atari yarababwiye yuko yahuye n'ufite ubwo burwayi, mu kumva bimenyekanye bitinze. Baracyari bake, ariko n'umwe ashobora guteza ikibazo. Niyo mpamvu twibutsa abantu bose bafite ibimenyetso by'umuriro mwinshi, kugira umunaniro, umutwe, gucibwamo, ntibatekereze ko ari indwara malariya n'izindi zigira ibyo bimenyetso, atekereze ko ushobora kuba ari virusi, cyane iyo afite aho yahuriye n'aha ngaha nyine, aho twayibonye yari yibasiye mu bitaro bya CHUK na King Faisal Hospital muri ICU cyane. So nasoreza aha ngaha, tukaza kwakira ibibazo byanyu n'ibitekerezo. Murakoze.
Murakoze Nyakubahwa Minister. Thank you, Honorable Minister. So right away we will receive questions, reminding you that questions can be addressed to Minister or representative of WHO. So I see a question from 3 questions here behind me. Okay, sir, you start, and then we'll go Kumonongo.
Thank you, Honorable Minister. I'm Paul Delicious Suna from Associated Press. Are you able to comment briefly on the safety of the vaccine? Because we meet some doctors who tell us off record that they are worried about the safety of the vaccine. Thank you very much.
Another one? Okay, thank you so much, colleague from Associated Press. So this vaccine, as we explained last time, is a vaccine that has been developed for the past many years. And the first phase of vaccine development looks at safety of the vaccine, which is phase 1 of the trial vaccine development. So this vaccine has already moved into phase 2 of the vaccine, which is an efficacy phase, which is different from the safety, which is on phase 1. So for those who receive the vaccines, of course the vaccine will give you some immune building when you had it. The doctors you talked about, all vaccine we received, immediately after or day after, you may have some body reaction to it. If is that the concern, it's normal for all vaccines, but at least assuring on the safety of vaccine study before it gets into humans or in the first phase of human development, that has been already reported, and science is available on that. And it's not the first time this vaccine is being used, at least for second phase. So we've seen it in the US, we've seen it in East Africa as well. And that's why, working with our partners, with our scientific advisory group, we've seen that it's safe to provide this vaccine. And we are going to know how the efficacy also will look like. Because once something is safe, it's okay. Now it's to determine how, at which level of protection this vaccine will be achieving. And that is the phase that we are looking into before it goes into the next phase. Maybe WHO will speak about these phases of approvals as well, because we are also working in close collaboration with WHO. We had initial protocols with WHO, and they're going to also to shift to those 2 protocols as we reach out to more people. So I think that's what I can say about the vaccine. And we will continue to make sure we provide the right information. And those who are receiving it, of course, they receive enough information about the vaccine before they can consent to take it. And most of them are actually scientists, they are medical professionals, they read about it. But also it's our responsibility as the Ministry of Health, our regulatory body, Rwanda Food and Drug Authority, who has provided the approval for rapid emergency use, so that we protect them against this virus, because the virus is going to, it's extremely aggressive. So any tool we can provide to protect the people is for us important to put in place. Thank you.
Murakoze nyakubahwa Minisita, nitwa Peter, nandikira Tarifa Rwanda. Agiye gushira hafi ukwezi iki cyorezo kigeze mu Rwanda, kugeza n'ubu ngubu nta kanunu kaho cyateye gituruka. Icyo ni ikibazo cya mbere. Ikindi cya kabiri, ODS organization ivuga yuko u Rwanda ruri gukora ibishoboka byose kugira ngo rurinde yuko abantu barwo bandura, nta hantu biragaragara muri community yuko hari umuntu wanduye. Ese nta kintu muri kuvugana na Minisiteri y'Uburezi kugira ngo ababyeyi babe bakomorerwa gusura abana mu bigo byabo by'amashuri? Bakoze.
Bakoze cyane, colleague from Tarifa. Aho iyi virusi yaturutse akenshi ni ikibazo kigorana kugisubiza, kuko usubira nyuma mu mateka ushakisha, hari ibyo turi kwegeranya, hari n'ibyo dushobora kuzabagaragariza mu minsi ya vuba, ariko bitavuga ngo ndabizi neza naha ni ukugenekereza. Hari abari kubikoraho, twari tuzi ko biza kuba byarangiye uyu munsi twabibageza, ariko ntabwo birarangira. Ni ikibazo mwatubajije ubushize kandi tuzabasubiza. Ibyo tuzaba dufite, ibyo twabashije kwegeranya mu mbaraga zose twashyizemo n'abafatanyabikorwa bacu, tuzabibaha kandi tuzajya ku mizi y'ibishoboka byose. Kugeza ubu ntabwo icyo kibazo nahita nyisubiza, kuko hari ibipimo bikeya, hari ibyo twakoze mbere byarangiye, hari n'ibindi turi gukora ubu tuvugana, hari ibyo gupima abasirikare umubiri ukora iyo wahuye n'undi, hari ibyo gushaka ubwoko bw'iyo virusi ukayihuza n'izindi, hari guhuza noneho na ya makuru yo kubaza waciye he, wagiye he umurwayi wa mbere. Ibyo byose iyo umaze kubyegeranya nibwo ugira umwanzuro uhagije, igisubizo kirambye. rero turashaka kubikora vuba nabyo bikamenyekana kuko hari n'ibyorezo byabanje na n'ubu mu myaka 10 ishize batarabasha gusubiza icyo kibazo, ariko twe intego yacu yari uko tugisubiza vuba bidatinze. So hatagize igihinduka nko mu nitwongera guhura dushobora kuzabaha amakuru arambuye kuko twagiye dushakisha dusubira inyuma. Icyo ni kimwe. Hanyuma ku kijyanye na gukomorera amashuri no kujya gusura abana mu mashuri, ni byinshi, hari ibyemezo byinshi byari byarafashwe mu cyumweru cya mbere biragenda bivugururwa. Hari ibishobora guhinduka, hari n'ibishobora kwiyongeramo. Ntabwo nabivugira ibizahinduka kuko hari urwego turi buze hari urwego tubikoreramo, dusuzuma ubundi biba bifite ibyumweru 2, amabwiriza amara ibyumweru 2. Igihe kirageze rero ko twongera kuyasubiramo, ubwo amashya nayo tuzayabatangariza mu gihe cya vuba.
Abakozi, nitwa Fiston Felix Habineza, nkorera urwego rw'igihugu rw'itangazamakuru RBA. Minisita, mukurikije ibimaze gukorwa kandi mwanavuze ko bitanga icyizere, ni iki muvuga ku bagaragaza impungenge mu by'ukuri mu cyumweru gishize twagaragarijwe ko zidafite ishingiro rinini, abantu bashobora kuba bari hanze bashobora gutinya kuza cyangwa se bashobora gufata ibyemezo byo gutinya kuza hano mu Rwanda. Ngira ngo na Africa CDC mu cyumweru gishize bagiye bagarukaho, mutumare mugire icyo mubivugaho, ariko kandi nashaka ko munagaruka ku I want to ask the representative of WHO what you can say about the people who is the foreign people who is not accepting to come here according to this disease. Muri make ikindi nafite ikijyanye naho indwara yaturutse, ariko mwabigarutseho, gusa nifuza ko mwabigarukaho mu rundi rurimi mu Gifaransa nabishoboka, aho bigeze kanagaruka kuri icyo ngicyo cy'abantu bagaragaza impungenge munavuga ko zidafite zishingiye hanini bashaka gusura u Rwanda, both Kinyarwanda and English. Thank you.
Thank you. I will first answer it in French. French.
French and English, if it's possible.
Okay. I will leave you French. Okay. So, urakoze ngira kamanzi subiza icyo warubajije mu rurimi rw'Ikinyarwanda kijyanye n'abava hanze bavuga bati se mu Rwanda haba hari kujya mu Rwanda cyangwa kuva mu Rwanda hari ikibazo. Nagira ngo twongere tubigarukeho yuko n'impamvu hatigeze hafatwa ingamba zo guhagarika imirimo n'ingendo mu gihugu n'abinjira n'abasohoka, nuko twabonaga ko icyorezo cyagaragaye ahantu hazwi, abahuye n'abarwaye barazwi, amarisite turayafite, turabakurikirana umunsi ku wundi. Ni ukuvuga ngo ahantu kiri urakibona, ntabwo ari ngombwa ko ujya gutera ikibazo kure yaho, kandi aho ikibazo kiri muri kuhakurikirana mu buryo buba bwarateganijwe. So ni nayo mpamvu rero ni kubavana bajya mu Rwanda ku kibuga cy'indege, navuze ingamba zihari zinarenze ibyo wagakwiye kuba ukora ukurikije n'ibyo ufite, ariko kugira ngo turengere cyangwa twirinde ko hagira na ya 0 n'ibice ya riske yabaho. Turongera rero gushimangira yuko abaza mu Rwanda, abakorera inama mu Rwanda, abakomeza imirimo yabo yose babikomeza, kuko uko tubibona aho turi gushakira icyorezo ntabwo byabangamira iyo mirimo yindi. Tunashishikariza cyangwa se tubwira n'abandi bafata ibyemezo ku ruhande rwabo yuko impamvu leta y'u Rwanda yashyizeho gahunda yo kujya inatangaza imibare y'ibihari byose mu buryo bwose bushoboka, ari kugira ngo ugiye gufata icyemezo abanza arebe se niba ngiye gufata iki cyemezo bijyanye n'imibare ihari n'ubushakashatsi buhari cyangwa hari ikindi. So abenshi rero barabyumva, abadusabye kujya gusura ahantu hatandukanye. Twakoze ikiganiro ejo bundi n'abahagarariye ibihugu byabo mu Rwanda, bifuza kujya gusura ku kibuga cy'indege ngo birebere uko gupima cyangwa gusuzuma uwaba agiye kugenda ko nta wajyana uburwayi ahandi, byose barabibonye barabishima, ndetse binatanga nabo icyizere bituma batafata ibyemezo bihutiweho. Icyo ni muri ya gahunda yacu ya leta y'u Rwanda yuko ibyo dukora byose bishingira ku bushakashatsi n'imibare n'ubuhanga kurusha uko byashingira ku marangamutima cyangwa se ku bindi. So nibyo tuzakomeza gukora muri iki cyorezo ndetse no muri COVID-19 n'ibindi byorezo byabanje, niyo yari gahunda, niko byagendaga. So numva icyo kibazo mwakibaje na mugenzi wanjye, namureka akabanza akagisubiza, hanyuma nkaza kugaruka ku cyo wari wavuze, naza kuvuga mu rurimi rw'igifaransa ngira ngo. Okay. He asked about the travelers and travels in this context from WHO. Maybe you mentioned also the statement from WHO as a reference that was issued the day before.
Thank you very much, Honorable Minister, members of the media, and colleagues. It's an honor to be in this briefing. It's a very important briefing by Minister and to be able to provide support. I think I'll start off with directly responding to your question, and then I'll give some of the context why it is important not to have travel or trade restrictions. So WHO advises against any level of travel restrictions or trade restrictions also with Rwanda, especially in the context of the ongoing Marburg outbreak. At this time, those restrictions we know are actually not effective, and also they are not necessary for us to be able to control the ongoing outbreak. It's not going to control any risks that are there for the outbreak to spread, because the initiatives already being taken by government and other partners to contain the outbreak are enough for us to be able to do that. So it's not necessary according to the World Health Organization, and actually it's potentially harmful to the affected societies and also to economies. Travel and trade restrictions actually can act as a disincentive, not only for Rwanda but for other countries to share information. Rwanda shared their information on the outbreak early. They have been working on the outbreak. They have been working with WHO and partners. So it's important not to have restrictions, because that can then have a counter, it can actually harm the outbreak responses. So I will also give a bit of a context, because that's also important. I mentioned about the response itself. Minister has talked a lot about what the country has been doing and is doing. In WHO, we complement the efforts and the leadership from government through the Ministry of Health in this response. The response itself has been robust, it's been coherent. The government is using the latest evidence, it's working with partners, it's taking the guidance that partners are providing for it to improve the response that the government is mounting. Also, Minister has talked about some of the progress that has been made. He talked about the data, about the numbers that we have seen, which have started to get less when we compare to last week. We see that there are fewer cases, but of course, it's still early days. But it does show that we're having progress. We are seeing people recovering, and that is a very positive sign, the recoveries that have been seen. And we therefore compliment, because this, when you have more people doing well, recovering, it usually indicates that the identification of cases of people who are infected and making sure they are put on supportive treatment early are some of the factors that result in you reducing the number of people who end up with complications or may die. So it's clear that the government is making good progress in this regards, but I think I keep emphasizing that it's still early days. So WHO and partners, we have continued to work with government in not only the technical area, where we have been helping bringing in not only WHO experts, but also experts from other partners. We have been working with government with regards to bringing in the critical supplies that are needed, protective equipment, especially for health workers, PPE, tests, and other supplies that we are working with partners, with our UN agencies to make sure they come into the country. So even though we are seeing progress, it's still early. This disease is a very dangerous disease, Marburg, and it's not, in looking at the experiences from other countries, because Rwanda is not the first country that has had this outbreak. We have experiences from other countries. It does take time. It does take a lot of work to be able to turn around this outbreak. I think I wanted to finish off my remarks by turning back to the heroes of this outbreak. And I think sometimes we're not talking enough about the heroes. As Minister has explained, this outbreak has tended, and as happens in many countries, actually many of these outbreaks of Marburg, usually, and that's the same also similar with some of the viral hemorrhagic fever outbreaks, they tend to affect health workers, and that's how many times they are actually identified. So the health workers, including the initial ones who were affected, were actually affected whilst working hard to save lives. So these are health workers who have put their lives online to save others, and many of them have succumbed, as Minister has said, and we believe that it's really important for us to keep talking about this. These are the heroes. Even after some of their colleagues died earlier on, many of those health workers, many of those experts continue to work hard, putting their own lives at risk. Of course, government and ourselves are working to ensure that as they work, they are kept safe, but still the risks are not zero. And these health workers continue to work with danger in their eyes, still continuing to save lives. So I think we need to applaud these heroes. We should not forget them. As I mentioned the other day, it's not only the health workers who are dealing with patients who are affected by viral hemorrhagic fever themselves, by Marburg, but also the other health workers who are ensuring that the systems continue to work, because that's really important, that we have continuity of our all our services. So I think in finishing off, let me just make just a few remarks with regards to the outbreak response itself generally, and some of the things that need to continue. I think Minister has talked about it. The issue of empowering communities is critical, something that we need to continue to do. The issue of ensuring that people who are either contacts or have symptoms access the health system early. 114 is available, they can call. It's really important, as I mentioned earlier on, when somebody is identified early with the disease and they are put on treatment, supportive treatment, they will do better than somebody who is identified very early or comes forward very early. So it's really important for communities to realize that when they have any symptoms, when they are contacts, they need to inform health authorities so that they can actually be supported. Continuing to support surveillance and contact tracing is very important. Minister talked a lot about the contact tracing. That's something that we need to continue to support and ensure that anybody who is a contact, and there are definitions for what a contact is, and that information is being shared with communities, they need to come forward. And then, of course, as I mentioned earlier on, the issue of supplies. So we continue to work with partners and we encourage partners to continue working with us in a collaborative way. What we're doing is working very closely with government, identify the needs, make sure that we support government to ensure that those supplies are in place. And of course, finally, Minister talked about the vaccines and therapeutics, which we are working with government on bringing in. And Minister explained very clearly that yes, the initial safety studies have been done, but now we need to show very clearly the effectiveness, and we continue to work with government and other partners in ensuring that government can access those vaccines, candidate vaccines and candidate therapeutics, so that we can do our best and government can do its best to turn around the outbreak, but make sure that we improve the survival of those who are affected and continue to prevent its spread. So we will continue to work with government and hope that this outbreak will be turned around quickly, as Minister has said. Thank you.
One colleague to position the next one is Madame la Ministre, Fiston avait demandé que la question par rapport au fait que nous avons pu tracer jusqu'à l'origine de cette épidémie. Je pense que c'est le moment de répondre en français. Merci.
J'espérais que le Dr Chilombo va répondre à cette question. Fiston, merci beaucoup pour la question. Je voulais juste dire que cette question, tout le monde se pose d'où est venu le virus. On y travaille depuis le début de cet outbreak. Et c'est une question très difficile à répondre parce que il faut passer du premier test confirmé, aller chercher dans l'histoire, je dirais, des personnes qui ont été en contact avec le cas positif et faire des tests de laboratoire avancés. Il y a des tests de séquençage, il y a des tests de chercher les anticorps des personnes qu'on cherche dans cette revue rétrospective. Ça nous a pris du temps parce que il faut chercher, il faut fouiller partout, il faut poser des questions. Il y a d'abord la recherche épidémiologique, en posant des questions, en collectant les données des personnes qui ont été en contact avec les tout premiers cas. Le deuxième moment, il faut chercher à comprendre la dynamique du virus, c'est quel type de virus, parce que c'est un virus Marburg, mais qui a beaucoup de variants qu'il faut aussi chercher au niveau du laboratoire. C'est un travail qui prend du temps, mais on a quand même des avancées. On espère que d'ici la prochaine session avec vous, le prochain briefing, on pourra vous donner un rapport avancé à propos de cette recherche. Je vais aussi reconnaître que même les épidémies passées, cette question s'est posée. Il y a même des situations, ça a pris 5 ans jusqu'à répondre ou ne pas même pouvoir répondre exactement avec précision d'où est venu ce virus. Donc, on essaie d'aller le plus rapidement possible, mais aussi d'être le plus précis possible à répondre d'où est venu le virus, parce que c'est non seulement une question qui va aider les avancées scientifiques, mais c'est aussi une question qui va nous aider aussi à être beaucoup plus préparés pour la prochaine outbreak, qui peut être la même ou qui peut être d'un autre virus ou quelque chose d'autre qu'on pourra identifier. On cherche sur plusieurs plans, le plan de l'environnement, qu'on appelle communément One Health. On cherche sur le plan human to human, la personne à la personne transmission. Mais aussi on cherche sur le plan beaucoup plus compliqué qui implique les deux. Donc je pourrais seulement dire qu'on a des avancées. On fait les derniers tests de laboratoire et les tout derniers on les a commencés hier pour connecter certains anticorps des personnes en contact et aussi le séquençage. Donc on va rassembler tout dans les prochains jours et on pourra vous partager les données dès que on est quand même quelque chose qui est du moins concluant ou qui sur lequel on est confortable que c'est ici qu'est venu le virus, ou du moins ce peut être ceci. Ce n'est pas l'équipe du Rwanda seulement qui travaille, on a reçu des collègues qui sont venus de l'OMS, de CDC et d'autres partenaires. C'est une équipe très large qui est spécialisée dans ce domaine-là, et on pourra, chaque fois qu'on ait ce genre de briefing, on pourra vous donner des avancées. Merci.
Merci, Monsieur le Ministre. We had a question from Lucie.
Bonjour, je m'appelle Lucie Mouillot, je suis la correspondante de RFI à Kigali. Pour être clair, les cas qui ont été enregistrés, les cas positifs qui ont été enregistrés cette semaine, est-ce qu'ils viennent tous du même cluster de l'hôpital, donc concernent principalement le personnel soignant, ou est-ce qu'il y a eu d'autres clusters ou d'autres cas dont on n'a pas encore déterminé l'origine? Et pour revenir sur la recherche sur ce premier cas enregistré au Rwanda, est-ce qu'on sait aussi si la personne a été contaminée au Rwanda ou si elle venait d'un pays voisin par exemple?
Merci. Ici de France RFI.
Oui.
Oui, je vais commencer pour la deuxième question parce que pour conclure à ce que j'ai expliqué à Fiston. Les progrès que nous avons à propos de répondre à la question de le virus nous montrent que le virus a été détecté dans un hôpital précis. Et c'est de là qu'on est parti pour rechercher toutes les personnes, tous les patients qui ont visité ce département, qui ont été soignés. Il y a ceux qui sont là et ceux qui ne sont pas là. Donc, il n'y a pas jusqu'à ce moment-là l'indication d'où est venu le virus en ce qui concerne le cross-border à travers les frontières. Mais ça sera répondu avec les données de laboratwari qui peuvent déterminer le genre de virus. Et si, au niveau des séquençages du virus, il y a une relation entre le virus qu'on a au Rwanda et le virus qui a été détecté dans d'autres pays. Donc c'est cette conclusion-là qu'on doit déterminer avec les derniers tests de laboratoire qui sont en cours et qu'on espère d'ici quelques jours pouvoir conclure et partager cette information. Donc ça serait pour nous très tôt de dire que le virus est venu de tel ou de tel pays ou de telle personne, mais l'essentiel pour nous actuellement c'est d'essayer de stopper la progression pour que le virus qui est détecté au Rwanda ne puisse pas passer à d'autres personnes au Rwanda ou au-delà du Rwanda. Donc ça aussi, ça rentre dans la logique de la première question que vous avez posée. Tous les cas confirmés cette semaine, ou même depuis les premiers jours, c'était les gens que nous avions dans les contacts qu'on suit. Il y a ceux qui développent les symptômes et on les teste et qui sont toujours en suivi de 21 jours. Et il y a ceux qui, même qu'on pourra aller au-delà de 21 jours parce que la science n'est pas très exacte. Si le 21 jours, c'est vraiment le maximum, on ne veut pas rater cette occasion aussi de contribuer à la science. Si quelqu'un développe des symptômes au-delà des 21 jours, des 22 jours, c'est quelque chose aussi qui pourra être essentiel pour d'autres outbreaks. J'espère qu'il n'y en aura pas. Mais le virus est très agressif. On essaie de détecter très tôt, de traiter très tôt. Et ça reflète aussi les succès du traitement. 18 personnes qui ont déjà été testées négatives 2 fois après avoir contracté le virus. Ça montre que si on donne le virus la chance de se multiplier pendant la première semaine, la deuxième semaine est très difficile à gérer puisqu'il a déjà envahi tous les organes. Donc ça aussi c'est important de le connaître et c'est là où les personnes puissent transmettre beaucoup plus. C'est pourquoi on a une longue liste de contacts et même les contacts des contacts pour qu'on ne puisse pas rater même un cas. de toutes les personnes qui sont testées positives pendant cette semaine, j'espère même pour la suite, c'est du même cluster des hôpitaux, là où on a eu des cas. Au début, c'était la plupart, c'est toujours des agents de santé, des médecins, et ce n'est pas tous les médecins de ces hôpitaux, c'est vraiment spécifiquement dans ces départements. Et on commence à voir, par exemple, un médecin avec un collègue qui travaille tout près, ça peut être un infirmier ou un médecin, c'est quand même spécifique dans ce département. Voilà, c'est ce qu'on sait actuellement et c'est pourquoi on dit qu'il n'y a pas de transmission communautaire, il n'y a pas des cas qui sont en dehors de ce cluster qu'on suit et c'est pourquoi on veut être beaucoup plus, je dirais, agressif au virus pour qu'il ne puisse pas s'échapper au-delà, parce qu'au-delà de ce cluster, c'est même difficile à contrôler. Voilà, merci.
Thank you, Honourable Minister. Do we have more questions? Abandi bifuza kugira icyo babaza? Are you satisfied? Vivien?
Bonjour Monsieur le Ministre, Vivien Laton pour le journal français La Croix. Vous dites que ça vient d'un service spécifique et d'un hôpital spécifique. Lesquels Est-ce que c'était King Faisal Est-ce que c'était de quel hôpital le premier cas?
Donc, le premier test qu'on a fait, c'était de l'hôpital universitaire de CHUK. C'est là où on a pris le premier test, le 26 septembre. Oui, le 26 septembre, la collection du premier test. Après avoir confirmé, on a réalisé que c'est connecté avec l'hôpital Faisal. C'est deux ICU départements qui travaillent, qui partagent même le personnel souvent, qui s'entraident. Et donc, notre cluster se limite à continuer à être les deux départements des deux côtés, parce que c'est vraiment une équipe, je dirais, même groupe. Mais en faisant les contact tracing, on voit les collègues des contacts qui travaillent ensemble, qui étaient dans la ressuscitation des cas qui étaient au dernier stage de prise en charge. De deux côtés. On voit que c'est la façon dont la plupart ont été exposés au virus. Et c'est ces mêmes personnes-là qu'on voit beaucoup plus dans le centre de traitement. Et c'est aussi les contacts de ces personnes-là qu'on voit qui sont testés positifs, du moins ces 7 jours passés. Merci.
Honourable Minister, the Bureau, I have no more questions. Maybe the last question from Ignatius.
Thank you, Honourable again. The story about the heroes. It is an interesting story, but do we have access to the heroes and maybe we speak to them? Maybe somebody who was sick and is okay has a covered, and even doctors, because doctors continuing treating people, yet their colleagues have died. Can we have access to such people?
So, why not? We of course, there were doctors and nurses. Now they're patients. They're being treated. They are recovering. They need some levels of help and support. There are those who continue to fight, despite having had their colleagues losing lives in the front line, or others sick. So we organize maybe the next session. We may see if they could be also having those frontliners joining our conversation or sharing in a way or another. So we'll ask our communication leads to work on that. I think having those testimonies also could be helpful. Thank you.
Thank you, Honourable Minister. This is considered and it's taken note of. I see one little last question from a lady. Please have the floor.
My name is Alice. I'm a journalist from the Meantime. I'm considering that these vaccines that are being delivered at the institute, 1,000 more. So I'm asking myself, you say that you're focusing on health workers only. What if a person who is not a health worker wants to get vaccinated? Is it allowed? And if not, is the military expecting more vaccines in the future? And my second question, sorry. There have been those activities, particularly religious activities that are being postponed. Is it related to the virus or not?
Yeah, on the vaccine, we of course we have a limited dose of vaccines. They're specifically designed to protect healthcare workers, frontline, ring vaccinations, close contacts. We are contributing to the science until the vaccine is put into routine vaccination, which per WHO could be soon. Actually, I want to highlight also most of vaccines we used in the previous outbreaks, like COVID-19, or almost the same stages of development. So it's a vaccine that is for specific situation right now. We don't expect it to be a routine immunization program for now. And on the question whether we expect more outbreaks in the future, or Marburg outbreaks in the future, I think outbreaks can happen anytime, anywhere in the world, in any place in the world. Why? Because these pathogens are everywhere. We are dealing with thousands of viruses and other types of pathogens that are potential to be outbreaks. So the best thing we can do is to be prepared. When it happens, how do we know quickly, and how do we respond fast, and how do we work together with the best science we have in the world? So that is what's happening in Rwanda. That is what should be happening in the other countries across the globe. So I think Marburg is not new in the East African region, and there's no way you can say this is the last outbreak in the East African region, or even in the world. But I wish next outbreak, if it does happen, we have more tools and better tools, and the best one that is known to work on every single disease on outbreak is vaccine. There's a lot of vaccine discussions and messaging and hesitancy, but having worked in this public health and global health for almost 20 years, I can tell you the best tool we have to deal with any disease is a vaccine. So the more and the faster we can develop vaccines for these diseases that are deadly, the better we can have a safer community, and the world could be better. Everything else is testing, it's isolating, then what? Then therapeutics sometimes doesn't do it to everyone. But when you protect kids, you protect people with vaccines, at least you know that when we are hit with these viruses, we are prepared. So I think that is what I can say about that. I don't know if you on that. So you had also another.
The activities that are being postponed.
Oh, the faith-based, the religious events. I don't think they are related, or if they are linked to our recommendations, because the guidelines that the Ministry of Health has been providing is the life continues as usual. We just add measures of safety, having clean hands, washing hands, sanitizing, like I'm doing, and to make sure that these, if symptoms are present, you don't take it as the usual symptom, flu or malaria or something else. In these days, could be a starting point of something we will discover. So this remains our recommendations, but the events, organizations, or postponing has happened before the outbreak. for some reasons, but is not from our recommendation. So let's do our first approach to stop this outbreak, so that everyone is 100% comfortable to continue. And we soon we are going to have full control of this virus and end it. It's already under control, as I said. We know the clusters, we know the contacts, we know the transmission chains, and the best way we can do for now is to make sure we share the right information, communicate the right things, and soon we'll be good.
I have been saying this is the last questions, but Minister, if you allow, we have a representative of civil society organizations, Limro, if you're willing to have his questions and then use the response as closing remarks.
Yeah.
Mark.
Thank you, Minister. Just I would like to know your impression about the contribution of the community. We are saying empowering community. How do you appreciate the contribution of the community in this regard?
So, thank you, Mark. The community plays a big role in any outbreak detection and response. There is a common say that outbreak starts with the community and it ends with the community. So the role of the community is very important. So for this one particularly, we've seen that the strong needs to have the community informed, the community receiving the right information from everyone, especially the media, communication channels is important. And we've seen also the importance of having both the community, the media, getting the right information based on science and facts and data. And we've seen also how the leadership and policy and stakeholders decision making is also based on evidence and is informed from the scientific facts that is available, and that the community takes or actually implement or accepts the decisions or actions taken when they are evidence-based, communicated right, and with the right leadership. So these are the four elements. We always say science, leadership, community, and communication. Four pillars must always be connected. So that's the reason why we've been having community, civil society representative joining our conversation. So far, we appreciate the role of the community. It's also self-protection. It's for everything we are doing is for the community. We can ask them again to consider this as a very important situation where a symptomatic person with fever, with headache, with muscle pain, joint pain, vomiting and diarrhea. This is a typical symptoms for many diseases, but when you see it, don't say it's just normal. Even if it happened to you last year, it's not normal, this situation. So, and please tell them or communicate, and we're also communicating to everyone, we are also part of the community, that it should not be as that simple symptoms that I had before. It could be Marburg. If it's on you, please just dial 114. If it's on your neighbor or your colleague, please dial 114. We have good testimonies, cases where in these clusters we are following, just people calling and say, there's a specific example of a student who was at Seashika and worked within this ICU, and then called and say, I've been there. I know they may have forgotten me on the list, but I've been there. And that is how we got to follow, and the student got okay and treated. So these are the kind of examples we want to have, that this cluster, the contacts, maybe 99% okay, maybe that 1% could come from that kind of feedback.